Next, we're going to take action or figure out now about this problem. What will I do? So should I do this or how do I do this? They might actually test your ability to safely and correctly complete an intervention. So here in this case, we need to answer this way. So we've got new lab results from 11. I look at my lab results. I've got a sodium that's a little low. I've got a potassium that is normal. And then this BNP is 600, so that's really high. So I've got stretch on the ventricles, and then why would heart failure make your sodium go low? How would that fluid overload do that? And I'll let you guys think on that one while we answer this question, which says we've got the diagnosis of heart failure. Which order should the nurse prioritize? So remember, if I'm going to do one thing for the patient and then walk away, what is that one thing that's going to help them the most? If you have too much fluid, you're going to be retaining fluid and it's going to dilute the sodium in your blood. Very good. It's called dilutional hyponatremia. So of these to prioritize, we're either going to prepare them for a chest x-ray, give 2.5 of enalapril, give IV furosemide, or prepare them for that echocardiogram. Have you heard before that on prioritization questions, you need to assess first? How many of you guys have heard that, yes or no, that you need to always assess first? And so that might be true if you don't have enough information to act, right? But I don't need to look at this guy's chest x-ray or his echocardiogram to know that he has fluid overload and to know that it's safe to give a medication, right? So I don't need to waste time to get these more detailed assessments. I already have enough information to act. And then these two, they're going to address problems, right? Enalapril, what class of medication is that, you guys? The name will help you. Enalapril, that's an ACE inhibitor, right? So that would lower the blood pressure, which we have an elevated blood pressure. So this would solve a problem. But yeah, by giving furosemide, that's going to diurese, and that's actually going to pull the fluid off. And because our problem is fluid in the alveoli, that's what we're going to address first. And if you weren't sure between these two, because, they're both indicated, we need to give both of them eventually. But remember, furosemide, what will that do to the blood pressure? If I give furosemide, is that going to raise the blood pressure or lower the blood pressure? Prabpreet says that furosemide is a loop diuretic. That is correct. It is a loop diuretic. That means it's potassium wasting, which means if this potassium was too low, I would need to give potassium before giving the furosemide or use a different diuretic. Furosemide would lower the blood pressure. Mary says it will drop it. Exactly. So if I give the furosemide and it causes hypotension, which it can, then I won't even need to do this at all. So you guys are exactly right. We're going to give furosemide. So taking action, remember our prioritization pyramid that we went through, we were addressing those circulation and breathing issues first. Breathing, that furosemide pulls fluid off of the lungs, relieves that pulmonary edema, whereas giving the enalapril would really just address the blood pressure and circulation issue. So we prioritized breathing. Step 6, we're evaluating outcomes or figuring, did it help? Or was it effective, whatever I did? Or what signs might indicate a complication has occurred? And so here we need to answer that in the form of this teaching. It's 2 days later, we're being discharged. We're being discharged on enalapril, metoprolol, and furosemide. So we already established this is an ACE inhibitor for blood pressure, and furosemide is a loop diuretic for fluid overload. Metoprolol, you guys know this one, the LOL is a beta blocker. So this is going to kind of slow and perfect that heartbeat to treat heart failure. So we've taught him about these medications, and now we need to figure out which of these client statements indicate that that discharge teaching was effective or that our intervention was effective. So is it correct if he says it's best to take my furosemide first thing in the morning when I wake up? And the rule that I always remember with Lasix is Lasix lasts 6. It has roughly a 6-hour half-life, which means if you give it at night, that patient is going to be up all night peeing. So yes, this needs to be taken in the morning, and that's correct. Then I should avoid eating prepackaged foods and over-seasoning my food with salt. Yes, patients often think when they're put on a sodium restriction that all they need to do is stop using the salt shaker, but actually most of the sodium in our diet comes from packaged prepared foods. So this is correct. Then should he contact the healthcare provider if he gains more than 3 to 5 pounds or 2.3 kilos in a week? Nobody gains fat this quickly. If they gain that much weight that fast, it's fluid they're retaining. And so that way they can up their dose of furosemide, come into the hospital, and we can prevent a heart failure exacerbation, which can be lethal. Then, okay, it is important to weigh myself weekly to ensure that I'm not retaining too much fluid. That's not often enough, guys, right? You guys know, how often do we need to weigh patients with heart failure? And it's more often than weekly. And they actually have really cool scales that connect to your app, like an app now on your phone, and the scale reads to you and notifies you if your weight has gone up too quickly. And the Braced Nightingale, which I love that name, says weigh daily. Yeah, you guys are right. We need to weigh daily. So this is not correct. This would require us to follow up and correct the teaching. Then, okay, certain over-the-counter medications like antacids can contain high amounts of sodium. Yes, many of them contain sodium. Some of them contain other electrolytes like calcium carbonate is in Tums. And so we want to make sure that they don't have any drug interactions. And we're correct.